infections, specifically sexually transmitted infections, is because this is a very important health problem in the United States. It is often underestimated how often sexually transmitted infections occur. They are transmitted among individuals through intimate contact. They can be caused by bacteria or viruses. They can also lead to infertility for women if they are undiagnosed and not treated. And one of the keys to sexually transmitted infections is that many times they can just be prevented by practicing safe sex. And so education is important, and early diagnosis can lead to decreased spreading of the disease and complications. So the first disease, or the first infection, that we are going to talk about is chlamydia. And so you can see the symptoms of chlamydia. And one of the reasons why chlamydia does not get diagnosed many times is that the symptoms can often be attributed to other conditions. Burning on urination may be thought of as a urinary tract infection. Spotting or vaginal bleeding, sometimes, as we talked about, may be attributed to their form of birth control, or they just may not think that something is wrong, such as an infection. Chlamydia is often thought of as the silent STI because these symptoms may just be so vague that the woman may not actually think that there is an infection or something going on. But chlamydia is the most common STI. And it is the highest between women between the ages of 15 and 19 years old. There are approximately 1 million cases reported and about 2 million unreported cases. So when I say that it is underestimated, undiagnosed, chlamydia is the most common. Chlamydia is something that is tested for prenatally so that we can treat the woman during pregnancy. Also, this is a sexually transmitted infection that we should be testing any woman who is sexually active. Okay. Treatment is we can either give the woman a one-time dose of azithromycin, or she can be put on a 7-day dose of doxycycline. Now, the one dose of azithromycin is great because we don't have to worry about compliance of the woman taking 7 days of doxycycline. The only problem is azithromycin might be a little more expensive because it is a higher dose, it is a one-time dose, and sometimes insurance may not cover it, or the woman may not have insurance. So that's it. Which dose is used would depend on the healthcare provider, would depend on the woman, would depend on compliance. So education for many of the sexually transmitted infections you're going to see would be that any sexual partners need to be notified. They should be treated. If the treatment is going to be an extended day of antibiotics, then it's very important that they complete all of the medications as prescribed, and she should be retested after treatment is completed to make sure that the treatment was effective and the infection was treated. The next infection is gonorrhea, which can be passed on also through intimate contact. Gonorrhea is commonly seen also in women who have chlamydia about 45% of the time. Once again, it can have non-specific or vague symptoms. As you can see, drainage, it can affect their menstrual periods, and it can have some pain. But once again, sometimes these symptoms may not be very obvious. They can vary in the the severity of the symptoms. They can be mild, so a woman may not think that something is going on. Okay, so they may not seek treatment. Treatment, antibiotics, ceftriaxone. Once again, it is a one-time dose. It is an IM dose, and typically women who are treated for gonorrhea are many times also treated for chlamydia because, as I said, 45% of the time a woman may have both infections at the same time, okay? Patient education, once again, safe sex. Remember that condoms are the only form of contraception that protects from sexually transmitted infections. Sexual partners need to be notified so that they can be assessed, tested, and treated if necessary. And if you remember from the newborn or the neonatal infection lecture, gonorrhea is the reason why erythromycin treatment for the newborn after delivery was developed. Syphilis. Now, syphilis is a little different and unique than the other sexually transmitted infections that we just talked about. Gonorrhea, chlamydia, they are treated just like any other infection. If they follow the treatment plan, take the antibiotics as prescribed, then the infection goes away. Syphilis has 3 different phases to it, or stages: a primary, secondary, and latent. Syphilis can become a chronic or lifelong condition if it is not diagnosed and treated early in its stages. So the primary stage is going to be the initial infection. Highlight this, red flag it. I can guarantee you that there will be a test question on the final exam about this primary stage. The primary symptom of syphilis in the primary stage is this canker. Okay, so circle this, do whatever you want to this word, a canker. A canker is a painless red lesion. It could be in the perineal area. It could be on the labia. It might be just inside the labia in the vaginal opening. Why it gets missed a lot of times is the fact that it is a painless lesion. And so if a woman is not actually visualizing that area or looking at that area, she may not see the lesion. Or if she is not going to a woman's doctor and having a pelvic exam at just the right time where that canker is present, it will go undiagnosed. And then it will move into the secondary stage. And then it may move into the latent phase if it's not diagnosed in the secondary. Once it moves into the latent phase, then all of these other symptoms will be gone. And then it may move systemic, and it may start to affect other body systems. Okay, and then at this point, we can't treat it with antibiotics. We can't reverse or cure syphilis. Okay, and so then it becomes a chronic disease. Okay, secondary symptoms that the woman may have would be a headache, fever, malaise, besides these obvious symptoms that she may or may not have. But once again, headache, malaise, fever, they could be attributed to many other different things. So she may feel that, well, maybe I just have a case of the flu, or I'm just feeling run down. So she may not seek treatment. Okay, so that is why it may move through that to that latent phase, and then she may not know that she ever had syphilis. There are screening tools, so if you have been paying attention to your clinical paperwork, your postpartum, or listening to report and heard them say VDRL, RPR in the paperwork, these are screening tools that look for titers or antibodies for the presence of syphilis in the body. And so this would tell us if a woman has had syphilis, if she has those antibodies in her system, and she's now in the latent phase. If she's going to be treated in that primary stage, penicillin is the treatment of choice. It is an IM dose. It's a one-time dose. Now, there is an interaction that can occur or a reaction that can occur when someone is being treated for syphilis with penicillin. I call it the JH reaction because I can't say the H word for some reason. And so it doesn't happen with all women. The important thing to remember is this is not an allergic reaction, but let the woman know that if she is going to receive the penicillin treatment, that she may have these adverse feelings of a fever. She may develop a headache, muscle joint pain. Basically, she's going to feel like she has a bad case of the flu. There's just this reaction with the syphilis that's going on in her body and the penicillin. And so she's going to feel like this, and she's going to feel kind of bad for a little while. But it will go away. She can take Tylenol or ibuprofen to help with the discomfort. Okay, we were going to follow up with her. She should abstain from sexual intercourse until the treatment is complete and there's evidence that the disease is gone. Once again, sexual partners need to be notified, they need to be tested, and they need to be treated. And then any sexual partners of them also need to go through the same process. Okay, pelvic inflammatory disease, or PID. This is when an untreated infection moves up further into the reproductive tract. So let's say a woman has chlamydia or gonorrhea. They are the most common causes of PID, and they have not been treated. So the infection is going to move up further beyond the vaginal canal. It's going to move into the uterus, maybe even up into the fallopian tubes. It may affect the ovaries. It may even move into the peritoneal cavity, okay? And what it's going to do is it's going to become a chronic condition, and that infection is going to turn into an inflammatory process. And so it's going to cause a lot of inflammation in those organs, in the fallopian tubes, to the ovaries, to the uterus. And so it can cause infertility. It can cause ectopic pregnancies because it's going to cause inflammation of those organs that are part of the process of becoming pregnant. It can affect the release of the egg to the ovary because it can cause damage to the ovary. It can cause inflammation, which will cause changes in the structure of the ectopic of the fallopian tube. It can cause strictures, which can then cause ectopic pregnancies. And just the overall inflammatory process can cause chronic pain in the low abdominal and pelvic area. So this becomes a chronic condition. So risk factors would be any risky behaviors that would make someone susceptible to or at high risk for chlamydia and gonorrhea. So multiple partners, unsafe sex practice, not using condoms, which, as before I've said, is the only contraception that protects people from sexually transmitted infections. Very long extended use of an IUD, because remember, the IUD does irritate the lining of the uterus. So sometimes it can cause a chronic irritation or inflammation of the uterus. Or sometimes, as I said before in the lecture on contraception, sometimes it can actually start to embed in the wall of the uterus. But now I'm talking like extended, like years. But a physician should be monitoring that and should be having a conversation with a woman after so many years of having an IUD in place. Okay, symptoms of PID, you can see, once again, once these symptoms really just start to begin, they may be shrugged off as symptoms of other things, just maybe not feeling well, maybe having a case of the flu or a UTI. They may be treated for a UTI at first. Vaginal discharge or irregular bleeding could be irregular bleeding. Maybe they may think that their periods are irregular because maybe they're having a lot of stress or things like that. So it may not be diagnosed until these symptoms continue for an extended period of time. And so really the key to PID is prevention. And prevention would be safe sex practices and prevention of sexually transmitted infections. So treatment in the initial stage would be at the beginning of the process to treat any infections when they happen, or to help with the initial infection that is causing the inflammatory process. So it would be any type of broad spectrum antibiotics. Depending on how bad the initial infection is, would be whether it could be oral treatment at home. Sometimes it can be so severe that it may have to be in a hospital with IV antibiotics. The pain can sometimes be so severe that they will need to be on bed rest, have analgesics for pain. No intercourse until treatment is done, until they get through that initial exacerbation of the pain. And then an IUD would not be this, as I said before, this woman would not be a candidate for an IUD. Usually barrier methods would be a choice of contraception for them to prevent any risk for sexually transmitted infections in the future. And as we mentioned before, avoiding douching, which could possibly affect that. We talked about the change in the vaginal pH, which could make them susceptible to other infections, which could then exacerbate the inflammatory process by putting her at risk for infections. Also, we want to make sure that we have a conversation with this woman and let her know about the possibility of infertility, and that we make sure that she has some support systems in place in case that is a possibility or that does happen when she decides to try to have children. HPV, human papillomavirus. This is a viral infection. It is a sexually transmitted infection. It is transmitted through sexual intercourse. It can cause two situations. It can cause genital warts, or it can actually cause cervical cancer in women. I have seen genital warts in women who have had HPV. Now, the genital warts can present in a variance of presentations. Sometimes, if a woman is exposed to HPV, she may actually develop a mild virus of the HPV virus, but her body may be strong enough to just kind of work through it, and it will resolve on her own. Depending on her immune system, depending on her body, it may do that, or she may actually develop genital warts. They are warts similar to what you would see if you were to develop warts on your hand. Those bumps that you develop, they're painless. They will appear, they will develop on the labia, they will develop in the vagina, they could travel up through the vagina, on the cervix, on anywhere on the perineum, up to the buttocks, on the anus. After, depending on how many develop, how much they are, then at that point, they may become painful. They may start to break down and become ulcerated just because of the pressure and the, I guess you could say, the rubbing that would occur because there would be so many of them. And I have seen an extreme case when I was a new nurse and I was working in labor and delivery. We had a woman come in. She was a young woman, I think around 20, and she did not have any prenatal care, and she had genital warts so bad, and I am going to apologize for another food reference, but she had genital warts so bad that it looked like there was a head of cauliflower sitting in her perineal area. And it was so bad that it was actually blocking the vaginal opening. And she had to have a C-section to have her baby because there was no way that she could deliver. And so, and I really can't tell you, this was like 30 years ago. I don't remember. She did not have health insurance or anything like that. So I don't remember if that is why she did not receive treatment for it, or, I don't remember that part, but it can get pretty bad. But sometimes the warts don't develop and the virus just resolves. Okay. The warts can be removed. And so then, hopefully they will not return. It is a virus. It cannot be treated with antibiotics. There is not an antiviral treatment for the warts. So basically, condoms for prevention. It is contagious. It can be passed on to sexual partners. So the key is prevention. There is a vaccine. Gardasil is, I think, probably one of the more common ones that you will see in the media. The key to the vaccine is it is most effective if a person receives it before becoming sexually active. Now, so that means that the vaccine should be geared towards and should be administered to girls and boys preteen. So when you see the commercials on TV and they're focused on middle school kids, that's because the vaccine is most effective before becoming sexually active. And we are finding that girls and boys are becoming sexually active in high school. Now, the vaccine can be given after becoming sexually active, and it can still be effective, but it is most effective before becoming sexually active. And so that is the key to prevention. Okay, we talked about herpes with the newborn. So this is now with the woman herself. And so as I talked about before, genital herpes is once a woman has the herpes simplex virus, then it is a chronic reoccurring disease. She will always have it. There is no cure for it. It will go through exacerbations and remission. Genital ulcers, she should not deliver vaginally if she has genital ulcers. It can be transmitted if she's unaware that she's infected, as we talked about with the newborn, transplacentally, or even there's a prodromal period before the ulcers actually, or she actually knows that the ulcers are there. There are medications that can be given to help prolong the remission periods, but it does not cure the virus. There are measures to help also with the remission, which is basically trying to manage your lifestyle, eliminating or reducing stress has been shown to manage the remission period and make that longer. Condoms should always be used. That should be a form of birth control for anybody who has genital herpes. Avoiding sexual contact through outbreaks just to decrease any type of risk. You can see the forms of antivirals that are used for genital herpes. I'm not going to test you on those medications. I want you to know more about the client education, how you would educate somebody who is being diagnosed with the herpes virus. Okay, so prodromal period or prodromal symptoms to teach them that they might tell them that they are starting to have an outbreak of ulcers would be any tingling, pain, or burning in the perineal area that would indicate that the ulcers are developing. They should always be assessing and visualizing that area for lesions so that they know if they're there. And then, as I said, stress management has been shown to be key to reducing outbreaks of lesions and prolonging the remission period. So stress management is a big one. And counseling can be a part of that. Counseling can be very effective in helping them manage just living with the virus. Hepatitis B, we talked about that with the newborn. You know that as a healthcare provider, it is in bloodborne, so any type of contact with blood, saliva, vaginal secretion, semen, is how hepatitis B is transmitted. It is an infection. It's a virus that is going to affect the liver, and it can be passed on to the infant through pregnancy. So all women, when they become pregnant, are going to be tested for hepatitis. Symptoms you can see: nausea, vomiting, muscle aches. Initially, some of these symptoms may not be attributed to hepatitis B. Sometimes can resolve on its own, but left untreated may lead to liver damage. There is the vaccine, 3 vaccines that everybody needs to receive, especially if we work in healthcare or in high risk areas. 3 vaccines, 3 injections over 6 months. Okay, and we talked about how the infant is treated after delivery if mom is positive. The baby will receive the vaccine and an immunoglobulin. Okay. HIV. HIV is a virus that initially will present like the flu, and then will progress and start to attack the immune system, and then will convert over to AIDS. Risk factors: it is spread through body fluids, blood, vaginal secretions, semen. Risk factors: IV drug use, high risk sexual practices, multiple sex partners, unsafe sex practice. Previous history of sexually transmitted infections may be related to unsafe sex practice. Okay. HIV is a very high risk diagnosis because it is a life-threatening infection. So we must have consent before testing for HIV. It is a very devastating diagnosis, and so it requires a lot of support when identifying the diagnosis and telling someone that they have HIV. It also requires a lot of support, not only for the treatment of HIV, but for maybe what was the underlying cause. Was it related to substance abuse, IV drug use? Was it related to unsafe sex practice? So we always need to know how did they contract HIV, so we can also address that issue with them. So they're going to need a lot of support, a lot of referral, and then contraception counseling, so that they can still continue to have a healthy sex life, but be safe and for themselves and others. So HIV, they will now have to use condoms because that is the only contraception that is protects from sexually transmitted. They will receive heart treatment, as if we go back this way again, antiretroviral drugs, it should be antiretroviral drugs, can prevent the conversion from HIV to AIDS if used properly and taken properly. And so it can extend that conversion for years and years, okay? So they will continue to be followed up on a regular basis with their physician. If the woman is pregnant and tests positive, then we will treat them, as I mentioned, with the infant neonatal infections. We want to treat her. It is okay to treat her during pregnancy because we can decrease the risk of transmission to that infant. If she is not treated, there is a 40% chance that the HIV will be transmitted to the infant. If we treat her, we can decrease that transmission risk to 1 to 2%. Okay? Okay, Couple more infections. These are considered vaginal infections. They are not necessarily considered sexually transmitted infections, but women's vaginal infections. Trichomonas. Trichomonas, if left untreated, can lead to infertility. It can cause changes in the reproductive system. It does have a very distinctive discharge, yellow, green, frothy. The inflammation of the vagina is what can cause the infertility. It can affect the motility, the ability of the sperm to reach the cervix and get into the uterus. It can cause pain upon urination, and then if untreated, the inflammation and damage to the vaginal wall and the vulva can cause pain during sexual intercourse. Treatment is Flagyl. It, once again, is a single dose. It's an oral dose. And then client education is, even though it can be passed on to sexual partners. Okay, so I guess it kind of can be even though it's passed on during sex, it's not technically classified as a sexually transmitted infection as of yet. It's just considered a woman's infection. But partners should be treated also. Okay. That's about it for vaginosis. Vaginosis is a vaginal infection. It also has a characteristic discharge that has a fishy odor. This is a very common vaginal infection of women. It is not related to sexual activity. If it is not treated, it also can create changes that lead to infertility. Pregnant women need to be treated if they develop vaginosis, because the infectious process and the inflammation that occurs can put a woman into preterm labor. Flagyl is the most common treatment, although it is a 7-day course. Okay, and it is very important that women know that they need to complete the treatment and take all of the medications for 7 days. Flagyl does have some side effects. They need to know that while on Flagyl, they should not drink any alcohol. If they drink alcohol while taking Flagyl, they can experience some nausea and vomiting, which can be very unpleasant and severe. Also, one of the side effects of Flagyl is a metallic taste in their mouth. So we want to make sure that they know about those side effects ahead of time. Okay. Vaginosis is strictly a woman's infection, so sexual partners do not need to be notified and treated. Candidias is a yeast infection, and once again, it also has a very characteristic discharge. It can cause pain on urination, and another characteristic symptom of candidias, or commonly called a yeast infection, is itching in the vagina and the labia and the vulva. Okay. I can't say the word. Fluconazole, 150 milligrams treatment. Nowadays, there are many over-the-counter treatments for yeast infections. So I still would counsel women, if this is the first time they think they have a yeast infection, I would tell them to go to their healthcare provider just to make sure that that is what is going on, that they receive the proper treatment for a yeast infection. If they commonly have yeast infections and they know that this is what they have, then by all means they can go to the local drugstore and buy an over-the-counter treatment. They are very effective. Sitz baths can be effective for the itching and the irritation. They don't have to have a sitz bath like we showed in class for the postpartum woman. They can just take the bathtub and just fill it with a few inches of water and sit in it. They should avoid sexual intercourse during this irritation or during treatment, only because it is going to be very uncomfortable. Okay. And then treatment is usually pretty effective, but a yeast infection can be very uncomfortable. And this is the second most common vaginal infection in the United States. Okay, and so that is it for this part of the lecture.